Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. So when it comes to shin pain, commonly known as shin splints, a major cause is due to repetitive stress and injury on the muscles and tendons that support this area, notably with a muscle called the tibialis anterior. Over time, inflammation can build and lead to muscle imbalances such as weakness and tightness that leads to pain. To fix this, I'm going to show 3 different methods that include releasing muscle tightness, stretching tight muscles, and finally strengthening them for both quick and long-lasting relief. Each part works just a little bit differently. To get the best results, go through all the exercises and use what gives you the most relief. With that being said, let's get started. In this part, we're going to focus on releasing muscle tightness that may be causing shin pain. Just a couple quick notes though before we start. The first being we're only going to go over soft tissue, things like skin and muscle. We're going to avoid anything bony like the shin bone because going over that can cause a lot of irritation. The next being if it feels like your pain is coming from your shin bone or deep within inside it, I would recommend consulting with your local doctor instead because there's a likelihood that you may be forming or actually have a stress fracture in your tibia that needs to be diagnosed and treated. So let's start by grabbing some form of lubrication like a massage oil or lotion that's designed to be put on the skin and coat your whole leg on all sides from your ankle all the way up towards your knee. It helps reduce friction and makes this a lot more comfortable. So let's start by targeting the hot spot for shin pain, especially shin splint pain, which is the bottom third of the leg, right through here. Let's take our fingers and start right below our knee and find the tibia, the shin bone. So you're just going to pinch right into this area, and the tibia is a pretty large bone. So you just kind of want to pinch and find both sides of it, and then you're just going to trace downward towards your ankle all the way down. The further that you move into this area, the likelihood is that that inner part of the ridge of the tibia becomes very, very sensitive and tender. So let's start right above the ankle and then go right off to the side of the edge of the tibia, the shin bone. We're going to take our thumbs and we're just going to do a light circular massage into that area for about 5 seconds, and then from there release it. See how it feels. If it feels pretty good, I just move up a little bit, again tracing the edge of the shin bone, and keep repeating this all the way up towards the knee. As you do this, you're probably going to find that one certain spot, like right here for me, is like a pocket of tenderness and achiness. And at that point, I just keep repeating this over and over again. And with each repetition, I just try to dig in there a little bit more. Just keep doing that until it finally releases or you're not getting any more improvement. And if you do find that one spot is really stubborn, it just doesn't want to release, at that point I would attack those soft tissue fibers at different angles. So you can go from side to side like this. You can also go down up. If you want to do kind of a long stroke like this, I always recommend going down up like this towards the heart to improve blood flow and circulation. But experiment with as many different movements as possible until you find the one that offers the most relief. So you're going to do this pretty much tracing the edge right here, the inner edge of the shin bone, working towards the middle part, and then finally go over the Achilles, working up into the calf muscles all the way towards the back of the knee. You then want to flip over and do the other side of the leg and then trace the other part, I should say the other edge of the tibia right through here, focusing on any spots that need it a little bit more. So if you would like to take this one to the next level and get a really deep release into these muscles and the soft tissue, you can do what is called gua sha or muscle scraping. So for this one, we just need a large metal spoon. You want one that's a little bit thicker too because you'll get better results. So with this one, you're definitely going to want some form of lubrication. So let's coat our whole leg pretty much from the ankle upward towards the knee. And we're going to start right here on that hot spot area. So let's trace our tibia all the way down, and we're going to start right here. So when it comes to the spoon, it doesn't matter what part you use. You could use the tip right here, you could use the sides, the rounded portion. In fact, during this, I would experiment with different parts of the spoon because you're probably going to find that certain parts of the leg just respond a little bit better to different parts of the spoon. But I'm going to use the rounded portion right here to start off with. This is pretty straightforward. So you're just going to take your spoon and angle it roughly 30 to 45 degrees. And it's really important when we do this that we apply enough pressure where it's going to be a comfortable self-massage, and you're going to always stroke from down going up. Again, we're trying to stroke towards the heart to improve blood flow and circulation. And you just want to go in that area over that soft tissue about 5 times. And then from there, again, see how it feels, and then kind of switch up a little bit, doing this over the whole length of the inner part of the tibia right here. And as you do this, you're probably going to notice, I'm sure that you can see it right here, this line forming over my leg. Red pockets will start to form over the top of the skin. That is completely normal. In fact, it's a really good thing. That's bringing blood flow into the area, which will help promote healing. So you're just going to, again, keep doing this pretty much over the whole inner length of the shin bone right here. You're going to work then towards the middle part. Let's go over the Achilles, really focus on the calf muscles towards the back of the knee, and then finally switch over to the other side and repeat. But again, focus on any spot that needs it a little bit more. So after the muscle release, I like to focus now on lengthening and strengthening the main muscles associated with shin pain. Let's start with the biggest one, the tibialis anterior over the front of our leg. What we're going to do first is start on our legs and knees just like this, and have your body nice and straight. Your legs are going to be roughly hip width apart, and what you want to do is slowly turn your feet and toes inward until you feel a light stretch forming over the front of your legs. You're going to hold this, and now keeping your back nice and straight, you're just going to lower your butt down towards the floor, kind of like sitting down. The more that you lower your butt towards the floor, the more that you're going to feel a deep stretch form over the front of your legs, targeting that tibialis anterior muscle. Once you feel that, we're going to hold this comfortably for 20 to 30 seconds, release it by coming back up, and then we're just going to repeat this 3 to 5 times. And with each repetition, try to build into it just a little bit more. To take this one to the next level and get a much deeper stretch, what we can do this time around is go on all fours. Again, let's have our legs roughly hip width apart. We're going to point our feet and toes inward until we feel that light stretch. But this time around, we're going to take the top of our feet and just press them downward into the floor as much as we can during this exercise. Next, we're just going to raise our knees upward towards the ceiling as much as we can. The more that you raise your knees upward like this, the more that you're going to feel a deep, intense stretch form over the shin. Hold this comfortably for about 10 to 15 seconds. Release it, take a breather, and then repeat this 5 times. And with each repetition, try to build into it just a little bit more. But go through both of those movements. You'll probably find that one just helps you out a little bit more. And at that point, keep throwing repetitions in until everything is nice and loose. So now let's focus on getting long-lasting shin pain relief by strengthening the tibialis anterior muscles. For this one, we're going to go right next to a wall. Just put your feet out in front of you just a little bit. That way we can lean our body weight into the wall. You want your whole backside flush against it. And when I do this one, I really focus on driving my butt, my glutes, right into the wall, not letting them lift off. So this exercise will become a little bit harder the further that you place your feet out in front of you. So I would start off placing them about a foot, foot and a half away, and if you need a little bit more of a challenge, just place them out a little bit further. But I like to have them also about roughly hip width apart. So what I'm going to do next is have my back nice and straight, and I'm just going to pivot forward just to the point where my shoulders and upper back now lift off the wall. But again, our butt is glued to that wall. From here, I'm now going to take my feet and just slowly raise my toes upward towards the ceiling while driving all of my body weight into my heels. The more that you go up, the more that you're going to feel a deep activation of the muscles around the front of your legs over the shins. This would be the tibialis anterior. Go to the point where it is a deep activation, and then try to hold this for about 5 seconds and then slowly release it. Allow your toes and the balls of your feet to go back down. But try to do this about 10 to 15 times, and with each repetition, try to build into it a little bit more. Afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or two, and also put your feet out a little bit more in front of you. But if you would like to take this one to the next level and make it harder, what you can do is go all the way up, hold that for 5 seconds, but as you come back down, let the balls of your feet hover slightly above the floor. It's going to be a lot more challenging, so I'd like to go down just to the point where they're going to touch. Don't let them touch. hold that for 5 seconds, and then just keep repeating this over and over again. So another muscle group that causes shin pain actually comes from the back of our legs with the calf muscles. To be able to target them, we can do an exercise called the eccentric calf raiser. For this one, we're going to step up on a stair and have the balls of our feet at the edge while our heels are directly off. What we want to do first is slowly raise our heels upward towards the ceiling as much as we can until we feel a deep activation into the calf muscles. Hold this comfortably for 5 seconds and then slowly lower your heels downward towards the floor, but don't let them touch. The more that you go down, the more that you're going to feel a deep stretch form on the back of your heel over the Achilles that works into the calf muscles towards the back of the knee. Once you feel that, hold this comfortably for 5 seconds, release it, take a breather, and then you're just going to repeat this going up and down for 5 complete repetitions. And with each repetition, try to build into it just a little bit more. Afterwards, your calf muscles should definitely feel like they're warmed up, a lot of blood flow coming in. So we can take this one to the next level now by doing our eccentric movements. What we're going to do instead of going straight up, we're going to tilt a little bit towards one side. So I'm leaning a little bit towards my right, and then I'm going to lift up. You're going to notice it hits the muscles a little bit differently. So give that a try towards the right and also towards the left. If any of those movements feel like they're a little bit more tight or weak, at that point, treat it like your weak link and keep building into it over and over again until everything is nice and loose, or it feels like you got a really good workout. And the great part about this one too is you can build all of these movements into a simple circle. So you can lift up on your right like this, go towards the center, go towards your left, and then lower your heels downward towards the floor. So I would try to do circles going counterclockwise with it, and then switching it up and going clockwise. Again, if any of those movements feel like they're a little bit more weak or tight, just keep building into it as much as you can. So to take this one to even the next level and help strengthen some more muscles, we can do what is called a tennis ball raiser. So for this one, we just need a tennis ball, and you're going to place it right on a floor. Place it in between your heels and then squeeze into the ball with your heels to the point where you can lift it up without having that tennis ball hit the floor. You're then going to just lift your heels upward towards the ceiling as much as you can. This time around, it should feel like a much deeper activation of those calf muscles. Hold this for about 5 seconds, release it, take a breather, and then repeat this 10 to 15 times. Again, with each repetition, build into it a little bit more. Afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. But again, with this one, to make it a little bit more challenging, try those eccentric movements of going towards the right, the left, and also doing circular motions. Just build into any movement that you feel needs a little bit more attention. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.